If you are looking to enroll in Obamacare, also known as the Affordable Care Act, in 2024, then these are 3 common and costly mistakes you want to avoid. What's up, friends? Rob here, Senior Medicare and ACA Advisor with Agape Insurance in North Mississippi. And today I'm going to jump right into it and cover these 3 common and can be costly mistakes if you're looking to enroll in an Affordable Care Act plan. Number 1 is enrolling at the wrong time. The best time to enroll in an Affordable Care Act / Obamacare plan is during open enrollment, and in most states that is from November the 1st through January the 15th. The things that you need, or a couple of things you need to be aware of, is if I enroll in the month of November or the month of December, my plan will not officially start until the beginning of that following year. So now it's 2024. If I was to sign up on 11/1/2024 or 12/1/2024 or somewhere in those months time frames, it wouldn't officially start until 1/1 of 2025. If I get past January the 1st, 2025, anytime between there up until the 15th of January next year, my plan would not start until February the 1st of 2025. So knowing these dates and these timeframes are very important, especially if you're needing coverage to help with a specific healthcare need. The other thing you need to be aware about, and I'll just put a little image on the screen here, is outside of the open enrollment, there are special enrollment periods that you can qualify for, like losing group coverage. Maybe some of you are looking to retire, but you're not quite Medicare agent, or maybe you're in between jobs, or maybe you've decided to start your own business or side hustle, but you're leaving your group coverage, or for whatever reason, if you went down to part-time at your regular job, they're not going to extend healthcare coverage for you, then that would open up a special enrollment for you to get affordable insurance through the Affordable Care Act. If you move states or zip code or county, if you have a baby, if there's a death, or if you went through a divorce, or here's a big one nowadays, a lot of people are losing Medicaid. It's what we're calling the Great Medicaid Unwinding. So if you're one of those people that's losing Medicaid, then you would qualify for a special enrollment to get a quality, affordable health insurance plan through the marketplace. The other thing is if you have extremely low income, if your income does not exceed 150% of the federal poverty level, then you qualify for a special enrollment all year round. So in other words, if you feel like you fall into this category, then you could simply call us on the number on the screen or go to our website and fill out a contact form. We work in most states, but if we don't work in your state, we will send you to a seasoned Affordable Care Act advisor to help you navigate through that. But if you qualify for this, or you think you do, then you really need to see if you can get quality insurance, because if that's you, and it's 4/11, it's the 11th of April here in 2024, then you could start a plan as early as May the 1st, the 1st of next month, if you qualify for this 150% special enrollment period. Once again, your income cannot exceed 150% of the federal poverty level. So if you fall into one of these categories, then definitely give us a call, the number on the screen. If you have a special enrollment period, then you do not have to wait. Once again, I need to be very clear. If you have a special enrollment period, you do not have to wait until the main open enrollment in the fall. Number 2 common mistake is not reporting the correct income. This is the most costly that I see many people fall into, because they try to, lack of better words, cheat the system, or trying to get the lowest premium possible, because your premium amount is primarily based on 2 things. Your income for the household. So if it's you by yourself, then that's going to be your gross income if you're W-2, or that's going to be your taxable income if you're self-employed, 1099, or a contractor, or if you're married, that's going to be both of you combined, whatever that figure is. So this is a very common mistake that I see many people either do, accidentally, or maybe they work with an advisor who just didn't know what they were doing, or maybe for lack of better words, they were trying to cheat the system. You do not want to do that here. You always want to do your best to report the appropriate amount of income. Once again, if you do not have someone to help you navigate through that, we would be more than happy to do that at no cost, no obligation to you. The number's on the screen, or you can get to our website and fill out a contact form, and one of our seasoned ACA advisors will call you. But here's the thing that we want to do. We always want to err on a higher income than we do a lower income. So if you feel like, well, because I'm self-employed, or, our income's kind of tricky, it's up and down, then we always want to go a little bit higher than we do lower, because if we go too low, then they're going to come back at the end of the year on our taxes when we get that 1095 form, that 1095A form there. When we get that form, they're going to come back and they're going to penalize us and charge us that difference in subsidy amount. So in other words, if I report an income, let's just say of $45,000 and my premium's only $135 a month, but I should have reported an income of $50,000 and now my premium should be, let's say, $200 a month, they're going to come back and charge me the difference times however many months I had that extra subsidy that I didn't need to have, right? And so we definitely always want to shoot higher than lower on that. Even if you shoot higher, but you were supposed to be at a lower income, then once again, that rebate, if you will reflect on your taxes. So you always want to shoot higher than lower to make sure that you're reporting enough income. And I know this can be tricky for some people because you may be in between jobs. Maybe you just decided to go self-employed, or maybe you're self-employed, but you have really big months, but then you have several months that you go without hardly any income. The bottom line is get with a seasoned advisor and let them help you navigate that so we can get this right the first time. By the way, if you are getting value out of this video so far, please take a moment to hit the subscribe button and the like button. This just helps us get this important information out to more people like yourself. All right, let's go to the final and third common mistake that we see, and that is selecting the wrong plan. Selecting the wrong plan is another common mistake that I see many people make. Here's what I see a lot, that people get called from these call centers, or people click on an ad online and they get promised zero premium. They get promised all of these extra benefits. And what they find out is, yes, the plan is zero, but it comes with a very high deductible, $7,000, $8,000, $9,000 deductible. And the challenge is you can't even use the plan until you meet that whole deductible. Right? Another common mistake that I see people get put on is a bronze plan. A bronze plan are generally the lowest premium plans, but they can be very tricky, come with no copays, as I just stated. It's basically like you're not having any coverage at all. Right. And so, especially when it comes to medicines, copays, and some other things. So this is something that we want to make sure that we look at and get put on the right plan. It's better to pay a little bit more premium and not get sold on that zero premium plan, because if you can't even use it at all, or it's not really going to cover anything at all, then it's really not doing you any good having that insurance. And the other common mistake that I see with some of these zero premium plans is they can only go see a virtual doctor, and then that virtual doctor has to recommend that they go to a regular brick and mortar doctor where they go in a particular facility. So this is something else that we definitely want to take a look at when we're looking on getting a plan. Don't get sold on the zero premium plans or the lower premium plans so much. Always make sure that you have copays that you can make when you go to the doctor, and you don't have to meet the full deductible. Always ask about the medicines, because that's a big one. Some of these lower premium plans, you have to meet that deductible before it even cover anything on your medicines. And that's a really big deal if you're on a higher tier medicine, or if you're taking multiple medicines. Like I've had some people take as many as 22 medicines. And so getting this right is very important. And I can't stress this enough. I know I sound like a broken record, but this is why you want to work with a seasoned Affordable Care Act advisor to help you navigate all the nuances and the challenges and just the hard to understand lingo in these plans, we would be more than happy to do that for you at no cost, no obligation. Simply call the number on the screen or go to our website and fill out the contact form, and we will make sure to get back with you to help you get on the best plan to address your healthcare needs. Well, thank you for watching, and take a look at some of these other videos.